your labs are great, but you are not. If you are waking up exhausted even after 8 hours of sleep, you've been to the doctor and all your labs are normal, stay and watch this video, because this kind of fatigue is not a motivation problem. It's a biology problem. I'm Dr. Destiny Grant, licensed naturopathic physician and nurse practitioner, and I specialize in helping women like you feel like themselves again, especially when everything is normal. Follow and subscribe if this resonates with you, because this month we're focusing on energy, metabolism, and how it affects our mood. Because fatigue, a lot of times, is literally a message that's telling us that something deeper is off. So let's get into it. So you're tired, right? Go take a nap. Wrong. Because sleeping doesn't guarantee that you're gonna actually wake up refreshed, especially if there's an underlying problem that needs to be fixed. Causes of fatigue can be metabolically driven, like thyroid disease, cortisol rhythm problems, or sometimes even hormonal shifts. Or B, they could be functional, like vitamin deficiencies, insufficient calorie intake, even your blood sugar roller coasters. And as a primary care provider, I could tell you what I know. This is not a part of your basic lab. And furthermore, some things that can be caught on basic labs, they don't even show up as abnormal until we're to the point of disease. But all the while, you're feeling the symptoms. So we're gonna tackle the 3 most common reasons that I see in my practice for fatigue. I'm gonna try to add timestamps in case you wanna skip around and just get straight to what resonates with you. Starting off soft, blood sugar roller coasters. All right, so if you are irritable when you're hungry, AKA hangry, your blood sugar is off. If you eat and then you literally have to sleep right after, your blood sugar is off. If you have cravings, especially for sugar, your blood sugar is off. All right, so let's talk about it. When we eat, the body receives our food, breaks it down into its simplest form, which is often sugar. Our body releases insulin, which goes out, it grabs the sugar out of the bloodstream into the cell. Now, if your blood sugar is high, that means either you're not making enough insulin or you're resistant to the insulin you are making. I will not bore you with the heavy, deep biology, but if you want me to go deeper and explain further about blood sugar and insulin and diabetes and things like that, just let me know in the comments and I will definitely film that type of video for you. All right, so this is gonna require some honesty. If you know you eat too much sugar, you know you gotta start there. You gotta cut it off. I would say cut off any added sugar completely for like 2-3 weeks. See how you feel. Are you still hangry? Are you still going into a food coma every time you eat? Like, are you still craving sweet? If the answer is no, you fix yourself. Outside of that, we're talking more of a metabolic or biology type of scenario. Either your body is not making enough insulin or your cells don't know how to respond to the insulin you are making. Now, we can test for insulin resistance on functional labs. So if you wanted to know about that, you could definitely look into that. But either way, with the blood sugar being high, it leaves you with like really high highs and really low lows, and you're wiped out. The second thing I see, cortisol dysregulation. A lot of people don't even tell you that very high cortisol can actually look like very low cortisol. The thing is that cortisol is a stress adaptation hormone. Your body produces cortisol in response to a stressor. So if you have too much cortisol, you're not gonna handle the stress appropriately. If you have too little cortisol, you're not gonna handle the stress appropriately. Thing is, a good amount of people actually make enough cortisol, but cortisol is not a one-time thing. It actually works in a pattern throughout the day. It follows a rhythm. And what I have found in my practice is that a lot of times the rhythm is off. So now I have a person that is dragging to wake up. They're suffering in the morning. They have to drink their coffee, which kind of peps them up, but then they crash. They've been tired all day. They're fighting at 5 o'clock. They can't wait to get out of work. And then they get home, they eat dinner, they're exhausted, they lay in the bed, and they're wide awake. Because cortisol, which should be high in the morning, coming down throughout the day, to be its lowest at night when you want to sleep, is actually low in the morning. And it's kind of riding the bottom of the barrel, and it's spiking 8, 9 o'clock. When you want to go to sleep, cortisol is spiking like how it should be in the morning time. Honestly, we have to reset the nervous system. Like that chronic stress, the body doesn't even know when it's safe to rest. So you lie down, you get too still, the body is scared and cortisol is spiking. So there's a lot of mental work that needs to go into it. And of course, we always have our herbs and things that we can use to kind of reset or shift back that cortisol rhythm. This is a really big topic. So this is another one. If you need a dedicated cortisol type video, put it in the comments, let me know. And the third thing, the last thing, is this thyroid hormone mismatch. I call the thyroid the CEO of energy and metabolism. The thyroid is responsible for how much energy you feel, how much you can burn calories, and even how you handle your stress. Most providers do what is medically recommended, and that is to do a thyroid hormone screening test. If this comes up either too high or too low, then it will trigger a deeper look into the thyroid. But let me tell you what I know. You feel thyroid hormone being off way before it shows up to be abnormal. Like way before. So like, don't get frustrated. When you hear your labs look good, everything is fine, everything is normal, it's probably just stress. Like, yes, it could be stress, but a lot of times it's more than just stress. We have to look deeper, and that's where functional lab testing comes in. That's why I prioritize functional lab testing, right? I was just now going to mention vitamin deficiencies as another reason, but I did say I was going to talk about the top 3. So I will leave it there. If you want to know more about vitamin deficiencies and fatigue, go ahead. Tell me in the comments and I will certainly make a video on that. So after learning all of that, I want you to stop assuming that this is a discipline issue. It's not that you don't work hard enough. It's not that you're not trying hard enough. I want you to stop blaming yourself and being hard on yourself. Like, why can't I just do better? Do you know how many times I hear that in my practice? I shouldn't feel like this. I should be able to do more. And please stop forcing more caffeine, forcing stricter workouts, forcing more restricted calories. This is only gonna push us further down that line of dysregulated stress response. So this month, we're gonna be going over exactly how energy, metabolism, mood, how they're all connected. Stay tuned for more. We're going deeper because you are not broken. A lot of times this is fixable. If any of this resonated with you, subscribe by clicking on my face and turn on your notifications. Put your comments and questions in the comment section like I mentioned before, and just stay tuned for when I go live to answer them. And then, of course, there are a whole lot more videos in the playlist that you can check out, and my most recent one is right here. All right, I will see you guys in the next video.